Hi everyone, my name is Julianna, and today Daniela and I are going to be talking about panic disorder. Before we begin, we would just like to do a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory is located, as well as X University. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Our agenda for today will include the following: an introduction, what is panic disorder, panic attacks versus anxiety attacks, some statistics, risk factors, as well as warning signs. Then I'll pass it over to Daniela, who will go over treatment, misconceptions about panic disorder, coping with panic disorder, coping with a panic attack, supporting someone living with a panic disorder, supporting a client, resources, and important points to remember. To begin, panic disorder is a type of anxiety disorder that can cause repeated and unexpected attacks of intense fear, along with the fear of having more attacks. It is a common misconception that panic attacks and anxiety attacks are the same, but they are two completely different disorders and even have some different symptoms and usual onset. More on this will be discussed in a later slide. Along with other mental health disorders, there is stigma surrounding panic disorder, as people often assume it is just an overreactive response, but this is simply untrue. Panic disorder refers to recurrent and unexpected panic attacks, which includes heart palpitations, sweating and trembling, followed by at least 1 month of constant concern about having another panic attack or worrying about the consequences of a panic attack, and or significant behavioral changes related to the panic attacks, such as avoiding exercise or certain activities and places that may have triggered the previous attack. Having a panic attack does not mean that you have panic disorder. Panic attacks are a common occurrence if you are stressed, overtired, or have exercised excessively. Panic attacks only become a problem if you are constantly worried about having another attack, or if you are worried something bad will happen if you have another attack. This fear is common after frequent panic attacks because these attacks are quite unexpected and unpredictable. This is different from having an expected panic attack due to something you fear, such as heights. It is a common misconception that panic and anxiety attacks are the same, and while they do share some common symptoms, they are, however, completely different conditions. To begin, panic attacks include an abrupt surge of intense fear or discomfort accompanied by other physical and mental symptoms. Symptoms are sudden and extreme. Symptoms include chest pain, shaking and trembling, feeling disconnected from self or surroundings, and panic attack symptoms peak within 10 minutes and then subside. And some attacks may last longer or occur right after one another, making it difficult to determine when one attack ends and another begins. Anxiety, on the other hand, is an emotional and protective response that is hardwired into the human body and our behavior. When anxiety becomes excessive or gets in the way of everyday life, such as work or school, only then does it become a concern. The symptoms of anxiety gradually build up, and symptoms include disturbed sleep, muscle tension, irritability. And symptoms of anxiety are similar to those associated with panic attacks, but they are generally less intense. Unlike a panic attack, the symptoms of anxiety may be persistent and very long-lasting, such as days, weeks, or even months. And finally, some shared symptoms of both panic and anxiety attacks include increased heart rate and shortness of breath. This image here just summarizes what was talked about on the previous slide, as well as just shows an easier way to understand the symptoms of panic attacks and anxiety and their shared symptoms. So again, panic attacks are sudden and extreme and include chest pain, shaking and trembling, and feeling disconnected from self or surroundings, while anxiety, on the other hand, gradually builds up and includes disturbed sleep, muscle tension, and irritability. And finally, their shared symptoms are increased heart rate and shortness of breath. Moving on to statistics. While up to 1/3 of Canadians can experience panic attacks throughout the year, only 1 to 2% in the same year would experience panic disorder. About 4% of Canadians will experience panic disorder in their lifetime. Women are twice as likely as men to experience panic disorder. 3/4 of people with panic disorder experience their usual onset before age 33. Another 3/4 of people with panic disorder report having at least one other diagnosed chronic physical or mental illness like diabetes or depression. Along with this, people with a family history of anxiety or depression are at a greater risk for developing panic disorder. More on this will be explored on the next slide of risk factors. Like with most mental health disorders, it is not exactly known why some people develop and some don't, but researchers suggest that there are various factors that can contribute to people developing panic disorder. Like most mental health disorders, panic disorder appears to be caused by biological and psychological factors and trauma. These factors include, but are not limited to, stressful or traumatic life events, a history of abuse, a family history of panic disorder or mental health disorders, and other medical or mental health disorders. There are many warning signs for panic disorder and panic attacks. These include physical symptoms, cognitive symptoms, and behavioral signs. To begin, physical symptoms include pounding heart, sweating, trembling or shaking, shortness of breath, feelings of choking, chest pain and discomfort, dizziness or nausea, sensations of heat or cold, numbness or tingling, feelings of unreality or being detached. Next are cognitive symptoms such as thoughts, such as, I'm having a heart attack, I'm suffocating, I'm losing control, or I'm going crazy. Lastly, the behavioral signs. These include avoiding places and similar places where anxiety symptoms or panic attacks have occurred in the past, and avoiding strenuous activities such as exercise, as these are thought to bring on panic attacks.
Now we'll discuss treatment. There are a few treatments for panic disorder, and they can help with managing the condition. These include psychotherapy and medication. Psychotherapy is often the first treatment used and can help to educate someone on the mental illness and panic attacks, as well as provide the tools to cope with them. Cognitive behavioral therapy, or CBT, is most commonly used and will help to teach that symptoms cannot harm by using exposure to triggers and anxiety-inducing situations, with the intention that symptoms will minimize. While it takes time to be effective, eventually symptoms will reduce. Medications can also be used to help minimize symptoms. Some medications that may be used include selective serotonin reuptake inhibitors, or SSRIs, which have small risks for serious side effects and are usually recommended as the first medication to try. These include Prozac, Paxil, or Zoloft. Another medication used is serotonin and norepinephrine reuptake inhibitors, or SNRIs. Benzodiazepines, such as Xanax, may also be prescribed, but only for a short period of time, as they can be habit-forming or interact with other medications. It is not recommended that you try this medication as a treatment option if you have a history of drug or alcohol misuse or abuse. You may have to try different medications or different doses before finding the right medication, but it is important to know that it may take weeks for the medication to begin working effectively. There are various misconceptions about panic disorder that result in stereotypes and stigmas that harm people living with a mental illness and can lead to underdiagnosis. It is important that we deconstruct these misconceptions to understand the condition better and reduce the stigma. The first misconception we will look at is panic attacks and anxiety are the same thing. Anxiety and panic attacks, as discussed earlier, are different. While feelings of anxiety can occur from time to time in everyone, and occasionally lead to an anxiety disorder, panic disorder is the result of repeated panic attacks that can feel similar to heart attacks or make someone feel as though they are dying. This can lead to different behaviors and symptoms between the conditions. Panic attacks are an overreaction to stress or anxiety. While panic attacks can result from feelings of anxiety, they are not an overreaction and can occur without any warning at any point in time. The feelings of fear and doom are very real to the individual and can impact them in all aspects of their life. It is important to deconstruct this notion as it perpetuates stigma about the mental illness. The next misconception is deep breaths will calm a panic attack. While deep breathing may help some people with coping, it may not help others and it will not stop a panic attack. Deep breathing can be beneficial, but it does act more as a distraction rather than a solution. And finally, panic attack triggers should be avoided. This is untrue. Avoiding triggers in the long run does more harm than good, and some treatment methods actually focus on exposing yourself to triggers, which will reduce symptoms and feelings of anxiety associated with these triggers. Coping with panic disorder. There are different ways that someone can cope with panic disorder, and we will discuss a few helpful methods. The first being, educate yourself about panic disorder. Understanding the mental illness and what is occurring inside the mind and body during a panic attack can be beneficial. With this knowledge, you can learn what your triggers are and how you can cope with them. Next, educate yourself on various techniques that can help to cope with an attack. Specific techniques and methods that can do this will be discussed on the next slide. Work on deconstructing your thoughts. There are two types of thoughts associated with panic attacks: overestimating and catastrophizing. To deconstruct overestimating thoughts, understand what your thoughts are and think about any evidence that may support or dispute your thinking. Questions you can ask include, has this actually happened, or how often do I have this thought during a panic attack? Try to remind yourself while these fears and thoughts appear real, they are unlikely to actually happen. Catastrophizing thoughts are another type of thinking that can be deconstructed. To do this, think about the worst thing that could occur and assess how you could cope with it. You could ask questions like, how bad is it really? Or what can I do to cope if it does happen? Many people also find it helpful to have what is called coping cards. These will have realistic views and thoughts about panic attacks to dispute these thoughts. Some examples include, it won't last forever, or I confused a thought with a fact. It can even be beneficial to read these throughout the day or as reminders in the morning. Try to stop avoidant behaviors. By facing what causes anxiety, it can help to work on how stressful a situation is perceived and can help to work on how the body reacts through fight or flight in future situations. While it can be anxiety-inducing at first, exposure to fears can be beneficial in the long run. But it is important to challenge your thoughts and remember your fears, while unpleasant, are unlikely to harm you. And finally, reach out. Reaching out for professional support can be beneficial. They can also help to provide tools to work through panic attacks and cope with the mental illness. While someone cannot stop a panic attack, there are techniques that can be used to help cope with one. The first important way is to remind yourself that it is temporary. During a panic attack, it can be difficult to think that feelings will pass. However, this reminder can be important as panic attacks cannot cause harm. Deep breathing is another technique that can help as it regulates breathing during a panic attack and can also help as a distraction as you focus on how you are breathing. There are various methods for deep breathing, one of which is displayed on the side. For some people, deep breathing can worsen a panic attack. If this is the case, try another method of distraction that works better. Focus in on an object. Focusing on an object, such as what it feels like, what it looks like, or how it makes you feel, can act as a distraction from a panic attack and can help with grounding. You could also try the 5-4-3-2-1 method. This method is another distraction. With this, you will list 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. For the last one, you can also try a piece of sour candy, which can add another distraction to help with the panic attack. Exercise. While it may be difficult to think about moving during a panic attack, this can help with regulating breathing. And finally, talk to someone. Having someone support you, especially during a panic attack, can be beneficial. If you consistently have panic attacks in a workplace, school, or another place, you can let an individual in that setting know so that they can support you. There are various ways to support someone living with panic disorder. First, you could educate yourself on the mental illness. This will help provide a knowledge base on what to expect. You can also ask them what they need. Needs differ from person to person, but it is important to understand what an individual needs, and this can help them also feel more in control. Additionally, it will make them feel safer in the case of a panic attack. Help them reach out for professional support. It can be difficult for various reasons to reach out to a professional. Therefore, it can be beneficial to have someone to support them while they find help. It will also assist them if they are unaware of where they can find supports. While it is important to help support others, it is most important you also look after your own mental well-being. Establish boundaries, reach out to talk to others about how you're feeling, and finding professional support for yourself when needed can all be beneficial. There are also ways that someone can support an individual during a panic attack. It's important to stay calm, watch body language. You can even start deep breathing, as people tend to mimic others' behaviors. Remind them that you are there for them, and while it feels real, they cannot be harmed and it is temporary. Provide them with a coping technique or distraction, many of which were mentioned earlier in the video. Help them to get somewhere quiet where they can focus on breathing and their coping mechanisms. While it is a popular belief when someone is having a panic attack, it is important not to provide them with a paper bag. This can be dangerous and is not recommended. Supporting a client. There are various techniques that practitioners can use in order to support their clients. First, it is important to explain fight or flight to clients. This can help them to better understand what is occurring in their mind and bodies during an attack. Figure out what their triggers are. Having them recount what usually occurs when they have a panic attack and discussing what might be the trigger can be beneficial. Sometimes they may be more hidden, but it is important to deconstruct what results in a panic attack. Remind them while panic attacks are not a pleasant experience, they cannot cause harm and are not dangerous. Use exposure. While this will cause some anxiety in the beginning, remind them that facing fears will be beneficial in the long run. Be sure to only do what the client feels ready to do while also challenging them. This will also help with avoidant behaviors. And finally, remain compassionate. Push for validation and empathy when working with a client. Validation can be key in making a client feel seen and understood and can encourage them to continue treatment. Now we'll go over resources. The most important thing to take away from this video is that there's supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We'll conclude this video with some important points to remember. Panic disorder is a type of anxiety disorder that can cause repeated and unexpected attacks of intense fear, along with the fear of having more attacks. Panic disorder can result in heart palpitations, sweating and trembling, among other symptoms discussed in this presentation. While it is a common misconception that panic attacks and anxiety attacks are the same, they share common symptoms but are different and distinguishable. There are various risk factors such as stressful or traumatic events, history of abuse, family history, or other mental illnesses. There are also a few warning signs that can be categorized into 3 groups, including physical symptoms, cognitive symptoms, and behavioral signs. To continue with some important points to remember, there are a few treatment options available for panic disorder, such as psychotherapy and medications. It is important to deconstruct misconceptions about the mental illness as they perpetuate harmful stereotypes and stigmas. There are ways to cope with the condition and certain methods that can be used to manage a panic attack. People can support someone living with panic disorder in various ways, but it is important that they look after themselves as well. Professionals can use different techniques to support their clients, however, it is critical that they center validation and empathy. While panic attacks and the feelings that arise appear real, a panic attack cannot cause harm and is not dangerous. That concludes this video on panic disorder. Thank you for watching.